How can you retrain bladder memory for better control? Imagine being able to go about your day without constantly worrying about urgent trips to the bathroom. Retraining your bladder memory is a safe, effective way to improve control and reduce urgency. It all starts with understanding how your bladder works. Normally, the bladder can hold about 600 to 800 milliliters of urine and is emptied 4 to 6 times a day without any urgency or rushing. When the bladder becomes overactive or overexcited, you might experience frequent urges, leakage, or a feeling that you need to go immediately. The goal of bladder retraining is to help your bladder regain a more normal function by teaching it to hold urine longer and to better manage the signals that tell you when to urinate. The first step is keeping a bladder diary. This means recording how often you go to the bathroom, how much urine you pass each time, how much fluid you drink, and whether you experience any leakage. This diary helps you and your healthcare provider understand your current habits and set realistic goals for training. Once you have a clear picture, you can start scheduled voiding. Instead of waiting until you feel the urge, you set specific times to go to the bathroom, such as every hour or two. If you normally go every 30 minutes, you might start with that interval and gradually increase it by 15 to 30 minutes as your bladder adapts. When you feel the urge before the scheduled time, use urge suppression techniques. Deep breathing, relaxing your pelvic muscles, or shifting your position can help. Pelvic floor exercises, often called Kegel exercises, are especially helpful. They strengthen the muscles that support the bladder and can reduce urgency. Distracting yourself or focusing on something else can also help resist the urge to go prematurely. As you progress, you'll gradually increase the time between bathroom visits, which can take several weeks to months. Patience and consistency are key, and positive reinforcement, like rewarding yourself for sticking to the schedule, can boost motivation. It's normal to experience setbacks, especially during stressful times, illness, or if you develop an infection. Don't get discouraged. Keep your diary, stay committed, and adjust your schedule if needed. Working with a healthcare professional is highly recommended. They can customize your bladder training plan, monitor your progress, and suggest additional strategies like pelvic floor muscle training for even better results. For those with bladder issues related to bladder cancer treatment, bladder training can be an important part of managing urinary symptoms. It is a non-invasive approach that can improve quality of life without medication or surgery. Remember, every person's experience is different, so it's important to seek personalized advice from your healthcare provider. In summary, retraining your bladder involves understanding how your bladder functions, gradually increasing the time between urinations, practicing urge suppression techniques, and maintaining regular, supervised practice. This approach is supported by current medical guidelines and can help many people regain better control over their bladder and enjoy a more comfortable, confident daily life.